Hello, my name is Zunair and I will be presenting about bipolar disorder. What is bipolar disorder? Bipolar disorder is an example of a mental disorder. Bipolar disorder 1 is when a manic episode lasts 7 days or by manic symptoms that are so severe that a person needs immediate hospital care. Usually, depressive episodes are also included, lasting about 2 weeks. I will go over what a manic episode is in later slides. Bipolar disorder 2 is a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes. I will go over what a depressive episode is in the later slides. Cyclothemic disorder, also known as cyclothemia, is when numerous periods of hypomanic symptoms and depressive episodes last for 2 years. For children, it is 1 year. People with bipolar disorder experience periods of abnormal intense emotion, changes in sleep patterns, and activity levels. These distinct periods are called mood episodes. A mood episode is when an individual is acting unlike their normal behavior. Extreme changes in energy, activity, and sleep go along with mood episodes. How do we detect it? Detecting mental disorders is not like diagnosing a typical disease or malfunction in the body. To understand the new technology that is being developed to cure bipolar disorders, it is essential to recognize the difficulty of pinpointing a dysfunction in the brain. For other diseases, there are blood tests and x-rays that make addressing a broken arm or HIV possible. On the other hand, mental disorders / diseases have neuroimaging, but scientists are questioning how much longer they can continue with this type of treatment. Scientists are using the physiology of the brain and are portraying that its malfunction is linked to specific diseases. What is bipolar disorder? Bipolar disorder develops around 18 to 12-year-olds. In a nutshell, it is when an individual has abnormal behavior and very fast mood changes. A manic episode is when a person is feeling very high or up, has a lot of energy, has increased activity levels, is feeling very jumpy, has trouble sleeping, becomes more active than usual. They think they can do a lot of things at once. They do a lot of risky things like spend money. A depressed episode is when a person is feeling sad, empty, or hopeless. They have very little energy, decreased activity levels. They have trouble sleeping. They feel like they can't enjoy anything. They have trouble concentrating. They forget a lot of things. They either eat too much or they either eat too little. They're feeling tired or slowed down. They also have thoughts of suicide. Symptoms of bipolar disorders are closely linked to depression and schizophrenia, which makes it difficult to diagnose. Many of the symptoms are similar, for example, aggression, mood swings, anxiety, and suicidal thoughts. In recent years, scientists have combined all the symptoms that are specific to bipolar disorder and made the Mood Disorder Questionnaire, known as the MDQ. MDQ is used by doctors who are unsure of what to diagnose their patients, depression or bipolar disorder. Thus, the questionnaires worked exceptionally well, and therefore many primary care providers are using them today. I'll talk more about this in the later slides. Mood stabilizers help during the peak and low times of manic and hypomanic episode of the disorder by preventing and treating it. They really help during social situations or in important places of work by minimizing the negative effects of episodes. These medicines are loosely called mood stabilizers by doctors, but the proper term is antidepressants that do not worsen the negative moods over a period. They loosely call it mood stabilizer so the patient understands essentially what the medicine does. Talk therapy works when it is done in combination with medication. It is an effective treatment for bipolar disorder. It can provide support, education, and guidance to people with bipolar disorders and their families. We have to realize that people with mental disorders have loved ones that they care about. So it's important for them also to understand how they can help in this kind of situation. The Mood Disorder Questionnaire was the result of years and years of research. Scientists proved that among the 70% of patients diagnosed with depression, 30% were mistakenly diagnosed. Approximately 30% of the patients had undiagnosed bipolar disorder 1, 2, or cyclothymia. As I said before, the symptoms of bipolar disorders are closely linked to depression and schizophrenia, which makes them almost impossible to diagnose. The MDQ includes 13 questions and a few more that are more specific to an individual. Many times, depression is linked to bipolar disorder, and the questionnaire specifically differentiates the two by asking the correct questions with respect to time. Essentially, the Mood Disorder Questionnaire can fight the test of time, and it can be used in future generations. Time plays an important role in bipolar disorders because many patients can go through years of therapy for depression before professionals conclude that they are patients of bipolar disorders. A beneficial aspect of MDQ is that professionals can use it as a first step in determining what mental disease an individual has. A survey that was coordinated by the National Depressive and Manic Depressive Association depicted that 73% of bipolar disorder patients were incorrectly diagnosed the first time they met with a professional from the medical field. This study shows that MDQ is essential to a correct diagnosis. The MDQ was used by doctors and showed that 7 out of 10 patients had bipolar disorder. In other circumstances, 9 out of 10 would be screened out. Individuals with bipolar disorders reported that the illness manifests itself early in life, but that accurate diagnosis lags by many years. The illness exacts great hardships on the individual and the family, and has a profoundly negative effect on careers. We have to realize that the people that are diagnosed with mental disorders have a future and they have a past. So we have to talk therapy really helps in determining how to go forward. In 2016, not all aspects of bipolar disorders can be differentiated from schizophrenia, depression, substance abuse, and many other mental diseases. Many parts of the bipolar disorders are associated with hallucinations and delusions. Consequently, several parts of schizophrenia are the same. The solution to creating differences lie in our DNA. Mutations in our genes code for these diseases. Scientists are still working to find the gene that encodes for the protein that carries out these specific mental diseases. Future projects include the synaptic signals between neurons in the brain, thus allowing researchers to fix a malfunction in the neurons. Right now, the drugs to treat bipolar disorders are not perfect, but if the speed of the synaptic signals increased or decreased, it could lead to another scientific breakthrough for mental diseases.